Hi, I'm Sam Holly, and I'd like to welcome you to the Calcium Therapy Institute. This is Dr. Mark Manhart, one of the co-founders of the Institute. We're located in Omaha, Nebraska, and I'd like for Dr. Manhart to explain briefly just what is the Calcium Therapy Institute, Dr. Manhart?
Well, it's a group of people that have gotten together, dentists and some scientists, and decided to. We were working with the calcium materials for a number of years, and we had thought, let's put this together so that we could kind of work together, even around the world. And so it's a group of us to practice these methods with these materials.
So why is there a need for an institute?
Well, it's probably because I felt that this approach to dentistry is so advanced, and this is what people told us, even in the government told us that it was so advanced that we needed something that would say, hey, this is something that should last, and this is something that is important, and it's so positive to what goes on in dentistry. Let's give it some identity.
Okay. How does calcium fit into, I mean, we know teeth are made of calcium.
Yeah.
How does calcium therapy come into play?
Well, calcium is involved with almost every biological transaction of the body. If it isn't calcium, it's zinc. And here we find materials that are just full of calcium, full of zinc. And in dentistry, we started out with some research that showed that in root canals it would really stimulate positive growth or healing. So we tried it on people, and it worked amazingly well and fast and efficient and safe. And it just evolved from the 1960s when we first started. It's like this is the kind of thing used in dentistry for 100 years, you see? But has it really been used for root canals? Not much. Well, we designed a non-surgical root canal treatment using these materials. And then about 65, we started trying it on other things because it just seemed to be, well, it made sense. If it worked on root canals, maybe it would work on trifurcations. Well, we tried it there, and then we tried it on gum infection.
Where would you say it stands today?
Today, oh my gosh. You know, it's like about every few years, something comes up. And especially when you're working with someone like Dr. Stegg, he's our associate, and with other dentists and other scientists, getting their input, things just pop up.
Are there some recent cases you can talk about?
And one of these cases, kind of inspiration cases came up just within the last 2 years, because we've been working on this case for 15 months, see? And what happened was the dentist took the x-rays before, during, and after. And when you put those x-rays before, during, and after together, I looked at those and I thought, oh my gosh, this is hard to believe. How did it get from terrible, terrible, absolutely no one wanted to touch this case? And in 7 months, it was half healed. And then in 8 more months, you look at it and you say, where was the wound? It's gone. And I'm talking about bony regeneration of the jaw.
Using these calcium materials.
Simple treatments of calcium material in the exact right place. And so here we are in 2016, and I'm going, this is so exciting. It was like discovering the whole thing in 1965 all over again.
So. How about that? Are these images available here at the
Yeah, we're
Institute?
putting it together, and we're going to put it on the internet. We have our articles and papers on the internet.
Okay.
Because this is information that the public has just got to know. You know, here we were doing this on bone for what, 45 years?
Mm-hmm.
And then we come up in an additional, astounding, like we're on the third case of this.
Mm-hmm.
And when this dentist up in Minnesota saw it, he just couldn't believe it.
Well, those are some pretty spectacular kinds of things.
Yeah, we want to talk about that.
I think, and what we'll do is we'll have some other spots for you to join us, where we'll be looking at a range of applications for the calcium and zinc applications and treatments. I see a familiar friend in your pocket there.
Yes.
Yeah.
This is one of the neatest things that, I don't know whether it was Tom or me, but we together figured out how to put calcium on the back of a toothbrush and make it stay so that you brush your teeth. And this little thing lasts about 6 or 8 months.
Boy.
Every time you use it, you give yourself a calcium zinc treatment all over your mouth.
Amazing.
So I keep it here in case I ever need it.
Very good. Good to have it handy.
Yeah.
If you'd like to see a rather entertaining demonstration of how to use
Entertaining.
this brush, there is one available here at the Institute. And if you'd like to learn a little bit more about Dr. Manhart, there is an autobiography. I believe it's an authorized one.
Well, so
you know, it'll give you a little bit of background about not just Dr. Manhart, but also the evolution of the use of the calcium therapy in different kind of applications and treatments. So we just wanted to welcome you to the Institute to get started and hope that you'll take a look at some of the things that we have. There's information for just the general public, people like me, and there's also rather detailed and substantial information for dental practitioners.
yeah, we are now training on Skype
Yeah.
and in person,
Yeah.
and we've gone to other countries. And I'll tell you, you get around the world like that, and you really hit on to people, very smart people. And so we're making this available. In fact, we've started now to train hygienists.
Mm-hmm.
And boy, is this something hygienists would just love to have.
And they can do this without being under the direct supervision of a dentist?
Well, yeah, in Colorado you can be completely separate from a dentist, but like this one hygienist said, she told her dentist, this is so neat, I just have to do it, and I'm going to do it and do it myself. And so he said, yes, ma'am.
All right, okay.
Which is good.
Promoting that independence there.
Well, they're good people, the hygienists.
Okay. Once again, welcome to the Calcium Therapy Institute. Glad you could join us and get acquainted with what we have here at the Institute on the website. And of course, there is a direct way to ask questions, to find training, including training for dental professionals. And we hope that you learn a good bit about the positive use of calcium and how it can benefit you in your dental health. Dr.
Thank you,
Manhart?
Sam.